Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In May of 2020, a study published in the American Journal of Clinical Nutrition looking at the link between diet and risk of dementia and Alzheimer's disease showed that after following 2,800 individuals over the age of 50 for 20 consecutive years, individuals with low intake of foods and drinks containing flavonoids, such as berries and apples and tea, were more likely to develop Alzheimer's disease and related dementias compared with individuals who consume more of these items. According to one researcher, a cup of tea a day or some berries 2 or 3 times a week would be adequate or protective, according to the research that we have. Another study researcher explained that even starting at age 50, it's not too late to make positive dietary changes that can ward off the development of dementia and Alzheimer's disease in the years ahead. As he states, the take-home message is when you're approaching 50 or just beyond, you should start thinking about a healthier diet if you haven't already. And of course, you should be thinking about it many years before the age of 50. So how might flavonoids in these foods and beverages reduce the risk of Alzheimer's disease? Well, animal studies show that various flavonoids, including the catechins found in black tea and which are especially high in green tea, inhibit the production of beta amyloid plaque in the brain, which is a hallmark feature of Alzheimer's disease. In other words, on autopsy, all Alzheimer's disease patients show this beta amyloid plaque in the brain. So we think that preventing its development can actually help prevent the disease. Now, many flavonoids also have powerful antioxidant properties, which may also slow brain aging. Now, in addition to flavonoids, research continues to emerge showing the protective effects of melatonin on the brain as we age. We know that melatonin hormone secretion declines quite significantly by the time we're 40 to 50 years of age. Now, melatonin is not only important for sleep quality, but it acts as a brain antioxidant and, like flavonoids, has been shown in experimental studies to inhibit the synthesis of beta amyloid plaque, a consistent feature of the Alzheimer's disease brain. Melatonin levels are also known to be especially low in Alzheimer's disease patients. Now, in recent years, studies have shown that melatonin supplementation can reverse mild cognitive impairment, sort of that prelude into Alzheimer's disease. As usually this early stage of memory loss called mild cognitive impairment, and it reduces or reverses this in a significant number of patients and prevents its progression to full-blown Alzheimer's disease. Now, several human intervention studies have now shown this very important outcome. Now, there are a number of nutrition and lifestyle strategies associated with a lower risk of dementia and Alzheimer's disease, such as not smoking, getting regular exercise, staying at or near your ideal body weight, and avoiding the development of type 2 diabetes, avoiding head injuries and concussions, keeping your mind active through continued learning, staying engaged socially, and so on. However, the evidence is to support the regular ingestion of flavonoid-rich foods such as apples, pears, berries like blueberries and strawberries, and green tea, and even black tea to some degree, has become very impressive, as has the consideration of taking 1 to 5 milligrams of melatonin 1 hour before bedtime each night after the age of 40 or 50 years old. Now, always check with your physician before introducing a new supplement to your wellness program, but melatonin has demonstrated a very good safety profile, which is quite reassuring as you seek approval for its daily inclusion in a wellness program. Now, I've included the scientific references for this information in the text below. Thanks for watching, and I'll see you next time.